Go.
We are all familiar with the role that doctors play and nurses play in our healthcare. Most of us have been to a doctor's appointment to receive an annual physical or gotten care from a nurse during a trip to the hospital. But how many of us are familiar with nurse practitioners? Perhaps you've heard that nurse practitioners are at the top of the U.S. News' annual ranking of the best 100 jobs in the U.S. Or maybe you're aware that the U.S. Bureau of Labor Statistics is currently projecting a 46% increase in nurse practitioner jobs from 2023 to 2033. But do you know why nurse practitioners are such a critical and fast-growing occupation in the U.S.? Today we will learn about the role of nurse practitioners in the U.S. healthcare market. Nurse practitioners are an essential part of the modern U.S. healthcare market because they provide personalized general healthcare services, improve healthcare affordability, and help fill the gap created by the growing shortage of physicians in the U.S. One of the main reasons nurse practitioners are essential to the U.S. healthcare market is that they provide personalized general healthcare services. According to research from the Journal of the American Association of Nurse Practitioners, around 87% of nurse practitioners are trained to work in primary care, and roughly 82% of nurses work in this setting. Furthermore, about 98% of nurse practitioners have a master's or doctoral degree, allowing them to provide expert care well beyond that of a typical registered nurse. This means that most nurse practitioners treat patients in local settings and perform a wide variety of general medical duties. Also, because nurse practitioners receive advanced education and training, they're often able to perform many complex tasks, from prescribing medications to even, in some cases, small surgical procedures. Depending upon practice regulations by state, a nurse practitioner's duties may be carried out in collaboration with or even in the place of general primary care doctors. So when you go for your annual physical, some lab work, or a typical clinic visit for a minor illness, it's quite likely that you will see a nurse practitioner at your next visit to the doctor's office. Now that we've explored the kinds of personalized services nurse practitioners can provide, let's talk about how nurse practitioners impact healthcare affordability. Another reason nurse practitioners are a critical component of the U.S. healthcare market is because they help improve healthcare affordability. According to a study conducted by Health Services Research, outpatient costs for VA patients who were assigned to nurse practitioners were roughly 90.7% of those of doctors, while patient outcomes remain largely the same. Furthermore, a similar study from Health Services Research finds that for Medicare recipients, inpatient admissions cost 7% less and primary care visits cost 18% less in Medicare benefits when patients are referred to nurse practitioners in the place of physicians. This suggests that nurse practitioners help save significant amounts of money while helping patients receive comparable care levels. These kinds of savings are essential for patients that have low to zero health insurance coverage and patients from low-income backgrounds. Furthermore, government Medicare expenses are also lower, which tells us that nurse practitioners help increase savings by cutting healthcare costs for governments and patients alike. As such, nurse practitioners allow places with limited funding to provide greater levels of care to patients at a lower cost. Now that we have covered how nurse practitioners help make healthcare more affordable, let us examine how nurse practitioners provide a solution to the growing physician shortage in the U.S. The third reason that nurse practitioners are critical to the U.S. healthcare market is that they help fill the growing gap created by the physician shortage in the U.S. According to a study published in the Journal of Public Health Policy, the AAMC is currently projecting a shortage of 21,400 to 55,200 primary care physicians by 2033 alone. This shortage is expected to affect up to 138 million patients. States that allow nurse practitioners full authority practice, meaning they can practice at a roughly equivalent to a primary care physician without restrictions, have reported improved access to care and lower rates of inpatient hospitalizations. As we discussed previously, nurse practitioners and general physicians have generally been found to provide comparable levels of care at lower cost to patients. As such, it makes sense that states that do not place burdensome restrictions on nurse care practitioners generally see improved healthcare outcomes. We have already seen what a strained healthcare system looks like in the wake of the COVID-19 pandemic. Nurse practitioners are our best opportunity to ensure that these growing physician shortages do not result in a public health crisis going forward. To sum up, we have covered how nurses help provide personalized general healthcare services, improve healthcare affordability, and address growing gaps created by physician shortages. I think we've all had some challenging experiences with the U.S. healthcare system. Unfortunately, many of its problems appear to be getting worse over time rather than better. However, the expansion of nurse practitioners in today's U.S. healthcare market presents an incredible opportunity to mitigate growing health issues, as well as a real opportunity to see some concrete improvements in our healthcare. Nurse practitioners are highly educated and competent professionals that are taking on the roles of physicians more and more. This is ushering in a new era of excellence and trust in the nursing profession. Perhaps in the future, whenever we need to find a new healthcare provider, the first thing that comes to our mind won't be a doctor, but rather a nurse practitioner.
Thank you. Very good.